Bonjour everyone, I am Annelise Caillez and welcome to Parlez-Vous CEO, where we ditch the corporate talk and get real about entrepreneurship. Each week, I chat with founders and CEOs who build businesses their way, through the failures, pivots, and breakthroughs. And they bring the fire. Plus, I'll drop some golden nuggets of wisdom from my own entrepreneurial journey. This is your space to grow, learn, and evolve with a true growth mindset. Remember, success isn't about perfection, it's about persistence. Now let's kick things off and get this party started. Hello, bonjour, bonjour, hello. Welcome to another episode of Parlez-Vous CEO. My name is Annelise Caillez and I am your host. Today, I am super excited to have another New Yorker with me today, Tejal Kaur. She's a psychiatrist, the founder of Grey Matters, a mental health advocate, and as I said, she's also a New Yorker, so she's a gangster. Tejal, I would love for you to share a little bit about your story and your background with the audience today.
Sure, and thank you so much for having me. So I run a mental health practice in New York City in Flatiron area. It's interesting to me because I never imagined that I would be running a practice. I never saw myself as a business owner. You know, when I was a kid, they were very nerdy things, but I wanted to be things like a writer or a journalist or a professor. And, you know, somehow I became a psychiatrist. But it was actually more that, you know, I think science was interesting to me and I was open to medical school. And, you know, my parents as immigrants were, you know, very encouraging that I should go to medical school. I got to medical school and I was so unhappy. And I kind of looked around and I was like, where are all the people with passion? You know, I want to be excited by what I'm learning. And, you know, I'm just like studying all day. When we started in our third year, we started doing rotations. And I had decided if I don't love anything, I don't have to continue as a doctor. I'll find a different career, but I'm going to finish. I'm not going to like quit in the middle of my career. And so that gave me some relief just knowing that in the end it would be okay, because it's important for me to live in the present as well. Like I have to be happy with what I'm doing in the moment, not just like working for something for the future. And I've noticed that when I do that, all of the things that I love come together along the way. So when I did my psychiatry rotation in medical school, I didn't know much about psychiatry at all, but I went into it and I never looked back. I was like, this fits me. And I think it was like the ability to hear people's stories. And really in psychiatry, I think even more than other fields of medicine, we're really encouraged to get to know the person. And so you really see them, you connect with them, and a lot of vulnerability comes out. And it really resonated kind of with my social justice background, because I'd always seen myself more as an activist than maybe a physician or something else. And I thought, like, this is where I can make a difference. And so I wasn't sure how I was going to make that difference yet, but, you know, I thought I'm just going to move forward. And I guess as I was moving, it's kind of a long story because I did many fellowships along the way. So I did my psychiatry residency, and then I was like, oh, I want to understand more about development and the brain. And so that I can be better at early intervention, and, you know, help people earlier in their lives, right? There's many severe mental illnesses. So for instance, schizophrenia was an area of research for me. And in the past, and even now, many people think that if you have a diagnosis of schizophrenia, that your life is over, you are very symptomatic, you're not able to work, but in medical school, I met this professor, Dr. Cadenhead, and she was doing a lecture and I was blown away. And that was kind of part of the like, oh, this is what I want to do. And she was talking about these programs where if you identify people that are at risk for schizophrenia early on, and even also those that have initial symptoms, that their outcomes can be so different. Like that they get better. They don't need to be hospitalized even many, many times. They have relationships and jobs, and it's not like what the statistics are. And so I wanted to do that work. So when I do something, I really want to delve into it. And so I started this child and adolescent psychiatry fellowship. I did that for a couple years. Then I did a research fellowship for 3 years in like neuroimaging and cognitive neuroscience, because again, I was like, I really have to get this. But I loved what I was doing at each step. And then I kind of started this private practice on the side, because I thought, I want to be an academic. A lot of the academics around me, they seem to have these private practices that are just like 2 evenings a week, like just a few patients, and it keeps up your clinical skills and it supplements like an academic income that isn't as high maybe as other incomes. So I was doing that, and then one day many things happened. I had one infant and a toddler at home, and I realized I wasn't enjoying my academic work anymore, and I wasn't enjoying going in. And I didn't want, so again, like about how I like to live in the present also, that it just felt too painful to have to go to work every day, not love my work, and then feel like I'm not with my children. So I decided to take that 2 evening private practice and just jump into it full time. And it wasn't just like just jump in though. So I really like data, and I looked at all my data. I looked at how many patients were coming in, how many intakes do I get, and um, how long have I done this? And at that point, it was maybe a year or something. And I thought, if I just put more time into it, this looks like it would be a full time career, and I'll be fine without a salary. So I took that jump. And a large part of it was also that I wanted to be around my children more. And I wanted the flexibility to be around when I wanted to be around. And I think what I've noticed as a practice owner and being in my own business is I probably work a lot more than I would if I was employed. But I put the hours where I want to put them, and it feels much lighter to have that flexibility and autonomy. And whenever my family needs me, I can always be there. So,
Now, I
so then, so I went into this practice full time, but within a year, so a little bit bored, where I felt like, I'm still kind of enjoying this, but I don't think I'm going to enjoy it as much in a year, like just working by myself. And how much impact am I going to make? As a child psychiatrist, my fees are pretty high, and how many people can afford that? And of course, like I do, or I don't know, of course, but I do a lot of sliding scale. But even then, as one person, how many people could I really affect? So a year into this, I decided that I would start hiring people and training them. And so I learned about nurse practitioners and psychiatric nurse practitioners, particularly. And it felt like that could be a very good complement to my practice, because psychiatric nurse practitioners are, they can prescribe, they can do therapy. They don't have like the medical background that I have, but they have they have solid training in what they do, and kind of like all of us, we continue to learn as we go forward. And what I really appreciated about their field was that they start as nurses. And I think that if you want to be a nurse, you really want to help people. There isn't as much, there isn't the prestige that there is like with an MD, right? So you're really doing this because you want to care for others, you want to serve others, and that was the type of kind of framework and mentality that I wanted in my practice. And so I thought, well, and I love teaching. That was one of the things I really loved in academia. So I could train people and I could create something And I used to think that I needed an academic institution or any institution to build something. But I started realizing that I could just build what I wanted. And it could even be better because there isn't that like red tape. And so I started with one person, Ruth Alexander, who's incredible. She's the loveliest person. And she's now our director of clinical services. And it's been a little over a decade that we worked together. And we're still working together. She trains everyone alongside me. And it's just been an incredible journey. Like we've just over time kind of slowly grown. And what's interesting, the pace has really been the what's comfortable for me in my life in that moment. We grew much more slowly when my kids were smaller. And as they started getting older, I started working a little more and I started expanding the practice. And now my daughter's entering high school and I'm thinking, well, maybe in the next year, I may actually even slow down a tiny bit because I want that time with her, and then I can pick up again. So I have really appreciated kind of that degree of flexibility.
That's so inspiring to me how I'm seeing you, how you puzzled and modeled exactly the life that you wanted. You're like, oh, I'm getting a bit bored here. Oh, I want more flexibility. I'm gonna build it like I'm gonna build this, and then I'm gonna build it like that. And also, if it's mine, then this is fantastic to watch. Like how you also had that belief in yourself that you could do it, and in a very pragmatic way. So I really like also how you look at the data, you did your projection, like you really took an educated risk on believing in yourself and starting your own. And you also wanted to be inspired and be driven by the mission that you enjoy. It's so many pieces in a puzzle that you figured out for yourself. I find that it's really beautiful to watch.
Yeah, I think this practice has allowed me to take all of the different parts of me and kind of bring them in,
Yeah.
and also leaving space for the other clinicians to kind of bring themselves. And it feels like this place really of connection. So the connection isn't just like with the patients, but it's like with each other and then with our community. And I think that really resonates very strongly in our practice. And I think it contributes to the high quality of care we deliver because in especially in mental health, but probably in other fields of medicine too, like the relationship with the physician or the NP or the clinician is so important that it really drives a lot of like the probability of success.
Mhm. What surprised you most about transitioning from academia to running your own business?
I don't know if this is a surprise, but there were so many parts I had to learn along the way. I don't think actually jumping into it, I knew how many parts there would be. Um, because you become kind of a jack of all trades, I guess. Like if whatever the problem is, you figure it out and you fix it. And I had to learn like accounting and numbers and business and thinking about projections. But then I was like also teaching myself how do I manage staff? And I would like read books on it and stuff, and like try to take, what felt like uh, what resonated with me. I have to learn like internet things. I have to learn, I don't know, like there's just like thousands of things.
It's interesting how you don't see yourself as a business owner, while from what I'm hearing, you were always a business owner. You were very entrepreneurial, like the way you made your decision and how you're moving towards building what you wanted to build and how resourceful. Yet you don't really see yourself as a business owner.
I think it took me a very long time to see myself as a business owner, and I do a little now. And I think I was telling you earlier that I didn't see myself as a business owner at all for many years, even when I was like actually running this practice. But I think it's about maybe what being a business owner means in my mind. And and I think my style of running my practice is maybe different. And I think I've been able to kind of embrace my own style and feel like it's okay. And there's years of showing that it has worked. So, maybe I can move forward and feel comfortable that this actually is who I am. I think the idea of business, I feel for many years, and even now a little, I felt very uncomfortable with money. When it was just me and my practice and I was working with people, I would so often just reduce the fees because, you really want to help this person. You feel like they're struggling and they're telling you how they have distress. And I would reduce fees before they would even ask me to reduce their fees.
So how did you overcome this challenge, which is,
Oh, the
by the
money.
way, a very common challenge?
Yeah.
And pricing, and because wanting to help, but at the same time setting your price right. How did you navigate?
I learned quickly that if I was too overly compassionate, I think, it's great and it's important. It's very important for me to be compassionate, but I have to be compassionate in a way that's sustainable. So I think I learned that early because I also saw around me, even in institutions, I saw different mental health like clinics or practices, or even within like hospital systems, like programs would start and there's such a need, but then they would close, because they didn't make enough money. And so I felt like whatever I do, I don't have to have a large profit, but we always have to have a profit because otherwise we can't continue. And so it's important to be compassionate, but I think that there's ways that you could be compassionate and have conversations with people too. So even like with our patients, if someone's struggling, we could have a conversation with them to figure out something that could work, and rather than feel like ashamed about talking about money. And so what I found is like going into these like uncomfortable conversations has really made my practice like much more sustainable.
Tejal, I think this is a very important topic that you're touching on. Women with money and female entrepreneurs not knowing exactly what to charge, especially female founders who are mission driven and work on social impact. Always very tricky. And even I am a marketer, and I always have this conundrum with wanting to help women start their businesses. And also, I love what they're doing. I love the mission. I want to help. If it was up to me, I would just work for free, all the time. And this is something that I've had to learn along the way, because I get this friction, right, with how much I charge. Plus, I really love what they're doing and I love the mission. But I'm also coming to the understanding that you can't help others if you can't help yourself, and the impact that you can have if your business is growing, like you can help so many other people at scale. So I think that's how I'm rationalizing it when I'm getting a bit, oh, what do I do for pricing? Is I also can't help people if I can't help myself.
Definitely. I think there's this strategy that we've adopted that we learned from this book by Adam Grant. He's an organizational psychologist from Wharton, and I love his writing. And there's this concept that he has that people are either givers, matchers, or takers in different areas of their lives. So let's say we're talking about work, are you a giver, matcher, taker? And that all of us in my organization, we should always start out as givers. And so let's say someone needs something from us, whether that's an employee or a patient or anyone. If we can provide that thing to them with minimal loss to us, then we should just do it. We want to create this community where people are helping each other, where people are connected to each other. Someone needs something, you support them.
Mm-hmm.
Now, let's say someone needs something where you're actually going to shoot yourself in the foot if you do that. Like, let's say I give someone like multiple weeks off for something, but now I'm going to be stressed out because I don't know how I'm going to make payroll, right? Then I shouldn't do that. But let's say they ask me for a couple of days off and it's an exception, but, I weigh things and I think, this is minimal loss and, this is important for this person. It's valuable for them. It's not as much of a loss for me. Let me do this. And so we always start out like that. And then in our relationships, if we find that someone else may not be as giving or it's not really reciprocated, then we never become takers, but we just kind of scale it back a little to matching. Like you don't have to go above and beyond anymore, but you kind of continue to be kind and helpful, polite, but not like overly giving because it's not reciprocated. And when you're in relationships like that, where something's not reciprocated, the relationship breaks anyway. Someone becomes resentful. Even the other side often doesn't really, even if they may want to come out ahead, it doesn't feel good to be in an unequal relationship. We really actually use that as a strategy when we're kind of making a lot of even business decisions. Can we do this? How much would it help the other person? And, does it shoot ourselves in the foot or not? And if it doesn't, let's move forward because it's important for this other person. And I think that has created like this community of supporting each other that has really kept, everyone in the practice like together.
And so I've read about the confident humility philosophy that I find fascinating. But how do you systemize this cultural value as you scale your team?
I think the idea of confident humility is very scalable. Like I don't feel that scale affects it at all. It's really just the idea that we should always be humble. We don't know everything. We try not to be hierarchical. Like so even with our patients are experts in themselves, right? But we are experts also in what we do. Each person can kind of put on the table their expertise and have a discussion and like kind of talk out, how do we move forward? Right. And one person isn't like higher or better than another. But so that's how I see the humility piece. Like, but you can still be confident. Because if you're only humble and you're not confident, then you don't really instill confidence like in the treatment either. When you're working with someone, they need you to be confident in what you're doing. Otherwise, why are you working with them?
So does it ever happen as a psychiatrist that sometimes you're not confident, you're not necessarily like super confident on what you're saying or a treatment, and you have to coach yourself to believe I want that person to trust me. I also need to show up a certain way. Is that something that goes through your mind as a psychiatrist as well? Definitely for entrepreneurs. I'm wondering for psychiatrists.
Definitely. And I think you can still be confident even when you don't know something by admitting that you don't know and just kind of, but having a plan that you will figure it out. So if I'm working with someone and I don't really know, I will probably tell them, right now, I'm actually not sure how we should move forward and I need some time to think about it. And sometimes I might take outside consultation from other psychiatrists or other sources, and I'll tell the patient too that, I want to think about this more. I want to get more thoughts about this. And I'll say sometimes like, oh, this area isn't something that I have expertise in, but this is what we can do. So I think it's important when I'm working with a patient that I'm going to like help them figure things out, whether I know it myself or not. And I'll admit what I don't know. And I think people respect you for that too.
I love that. I love this answer.
Because you can't know everything, right? So whether you're admitting it or not, you don't know everything. And I find it just much easier to, admit what I don't know and how I'm going to figure it out anyway. And, but the other thing that I really balance in those moments is that I feel like, even though no one, so in our practice, we really have this idea that no one is better or higher than another person, right? We're coming in with kind of like different areas of expertise. Um, but that doesn't mean we don't have roles. Like I have a role as a physician when I'm working with a patient. And I think part of my role is to help them feel comfortable and calm and kind of contain the space. And so if
Mhm.
I don't know something, even if I'm anxious about it, I try to not show that externally. And
Mhm.
I don't deny it to myself. I'm aware of it, and that's why I'm going to figure it out. But it doesn't help my patient for me to show my anxiety, right?
Mhm.
So I try to balance kind of that humility with the confidence because it's necessary for my role.
Wow, I love this. Is really interesting in hearing this because I think that's a balancing act that entrepreneurs have to do a lot, whether it's with clients or with patients, regulating our own anxiety because it doesn't serve whoever we're trying to help. So I love that concept of confidence, humility. I think that's very different from what I'm in general hearing and seeing about founders.
I I've always had a hard time talking about myself. You know, when I do, I feel like I'm bragging and I shouldn't brag. And this hurts my practice though. And it's something I'm aware of and I need to work on more because I feel like we do, like my whole team does such incredible work, but not enough people know that we exist
About it.
because we're not talking about ourselves. And
Hmm.
I'm trying to kind of tell myself that it's really not bragging. You know, talking about yourself is the way that you will help more people. And I just need to get over it. And that there will always be people
Absolutely.
there's always going to be someone that's going to perceive you negatively and think you're bragging, but that's just going to happen. And I tell myself now, like, I just have to deal with that and do what is necessary for my practice to
Hmm.
grow in a way where we are able to support more and more people.
Hmm. What you're describing is unfortunately very, very common among female founders. It's very hard to celebrate the wins because it feels like bragging. Because I think we've been taught to be cute and not talk too
Mhm.
much and not talk too loud and not, and be like a flower. So I think sometimes it can come off as uncomfortable. There's this fear of visibility and that sensation of, am I bragging? It's very hard to work on. It's very common, but you're absolutely right. The way you were reframing it's completely correct. You can help more people the more visibility you have, and that's also when I get scared of an exercise, going on camera or doing my own personal brand, which I used to be really scared of a couple of years ago. I'm still navigating and going through this, but I also, again, I understood I can help more people the more my voice can be heard. So whenever I get scared, I hold on to that because I really believe that the more visibility, the more people you can help.
Definitely. It's just hard sometimes I feel like it's important to keep reminding yourself of that, of why
I
it's
think it's
necessary.
important to remind yourself and being surrounded by people who are doing it. And so,
Found
Teja, yeah, go ahead.
in my process, I found other women entrepreneurs to be so helpful. And I've at times reached out to people that I don't even know that well, and then others that I do know well, and really just asked for advice. And I'm really open to when people reach out to me as well. But I've really grown through those connections. And there's something about other women, talking to other women, they just really get it. And their advice or their thoughts like resonate better.
Absolutely. Because some things that can work for men in different businesses doesn't always apply to women. Like I think it's different challenges, especially when it comes to branding yourself. It doesn't always come naturally. It can be a hard exercise, and that fear of visibility. And Teja, your practice, it really transcends traditional therapy boundaries. So how do you balance innovation with regulatory requirements and industry standards?
I think I'm constantly trying to think outside of the box. And I think about like, what do we need and how could that be possible? So, for instance, we have to have certain um, privacy measures and technology measures and um, in our record keeping. But I we created our own health record by using a customer relationship manager, like a business CRM, but transforming it into a medical CRM because it did have some of like the technological things that would make it okay for us to use in the medical space. And we really just customized it for ourselves because there wasn't something out there in the medical space that wasn't like hundreds of dollars per month per person that we couldn't afford, and that actually did what we needed. And so we just created it. And I think I really love running a practice because I like creating things and I like problem solving. And when we kind of face a barrier somewhere, we just figure out like how can we get to where we need to be.
So resilient and so entrepreneur. You're such an entrepreneur. I find it so fascinating that don't you have had trouble seeing yourself as such.
I think another part of our practice is, oh, sorry. That I think another part of our
Go
practice
ahead.
that's special is like the space that's been created for the clinicians there. There's such a huge issue of like clinician burnout, and especially in areas like mental health. And all of us that go into this field, are really like we give so much that we burn out. And that's kind of like the default. And there are also these other pressures of, if you're insurance based or you're working in a system, how many people do you need to see a day? And, what type of quality can you deliver then? And so I really also wanted this practice to be a place where the clinicians could come in and practice in a way that was aligned with their values and where they could give good care. And it's been a balance to be able to do that in a way that's still financially profitable, because we are lower volume and we still pay our clinicians well and they have a lot of benefits. And I think that that's been important because I really want to create a space where people feel that they are cared for and supported, that the employees feel, that we care about them. Right. And I think showing that we care, but having difficult conversations when needed has shown people like a consistency, I think, in our practice that makes people feel safer. That even when I'm anxious, I have to stay consistent with my values or the way I run things, because if I'm inconsistent, then the team will get anxious. And there's definitely times where I have been inconsistent, and I really appreciate that my team members speak up and tell me, when I may be being inconsistent with how we should be running things or our values so that I can do it again. Because there are so many stressors, and then you're stressed and you want to figure it out quickly, but maybe that's not the best solution. And so it's been really helpful to have a space where these clinicians are also, where they have the space to speak also about the practice and to give their thoughts, and then also to practice in ways they want. So it's been a really great experience. And I think that our turnover is lower, I think, than other similar, maybe like in our industry, there's like a lot of turnover, particularly because of burnout too and other things. And our clinicians really want to stay, I think, because they know that they're cared for.
And that says a lot about the health of a business, a low turnover. And Teja,
Yes.
If you had to give yourself a piece of advice for when you started your business, if you had to restart your business all over again, what would you tell yourself, or what would you tell a new therapist who is looking to start their own practice and scale?
One of the, I feel like, I've wasted a lot of time over the years, um, feeling, I feel like I've wasted so much time over the years, like judging myself and thinking about like, oh, I made this mistake. Why didn't I know better? And I think I would tell myself from the beginning that I didn't have to get everything right. I just need to like have people around me that can help me and know how to seek like where to go for help, um, and not beat myself up. I feel like for many years, if something didn't go perfectly, I felt like, oh, I should have known that. Why didn't I know that? And now I've kind of just come to accept that running a business means making mistakes, and I'm going to make mistakes, and I just have to like learn from them, recover from them, and move forward. Because when you're stuck in like blaming yourself for something, you're not growing anymore. So I feel like that really interfered for a long time.
Yeah, this is a great piece of advice because I think, as you're describing, it doesn't serve you to be hard with yourself like that. It really doesn't. Where there are, you cannot make a business without breaking some eggs.
Mm-hmm.
It's bound to happen. You will make mistakes, you will fail, but it's how fast can you rebound? And in order to rebound fast, you need to give yourself grace in those moments. You are your own coach, your own parent, you know. So it's absolutely, I agree with you. I think, and I still do to this day. I think I get very hard with myself when I make mistakes. And it's something that I constantly try to improve and say, that's also part of growing a business,
I also would
and
look
it's
around.
okay.
Oh, I'd look around and see, especially in the mental health space, a lot of practices scaling quickly. And so there was a time some years ago where I was like, why don't I scale? How come I'm not growing as fast? And I think actually those were the couple years where I did grow pretty quickly and we really multiplied the number of staff. But then I realized that I don't have to follow what other people are doing. And this feels kind of stressful to grow this fast. And why is it necessary? I'm trying to build something that will continue to be around and continue to be around in a very like solid way. And
Hmm.
growing too fast will decrease the quality. And I was never willing to decrease quality. And so that was also why when we were growing fast, I was so stressed out because I was like just working so hard to grow everything, but it just isn't worth it. I think that what I realized is that I don't know if scaling always leads to a good product. And I wonder
Hmm.
if it actually does. And I want our practice to be one that just grows organically in ways that make sense and in ways
Hmm.
that I'm not so stressed out in my life and my employees are not stressed out, just because we're trying to like do what other people are doing.
I agree with you. I think there really is a way to scale intentionally, but it's usually by experience that you realize that you try doing what others have been doing, and you don't really listen to yourself and what works for you, and that's when that gets uncomfortable. It's again when you're not paying attention to what you want and you're trying to mimic what others are doing. And so, Tejal, this marks the end of the episode. It was super fun to go through your story. It was so nice to get your insights. Can you share with our audience where people can find you?
Yes, people can find me on our company's website. So our practice is Gray Matters Medical Practice, and the website is graymattersmd.com. And yeah, and that's probably the best way to reach me.
Thank you so much for being here on Parlez-Vous CEO and sharing your story. Tejal. And that wraps up today's episode. I am Annelise Calles, and I can't wait to join you again next week. Thanks for listening to Parlez-Vous CEO today. If you enjoyed the show, leave a 5-star review. It helps us keep going. And connect with us on Instagram at Parlez-Vous CEO. I am Annelise Calles, and I know some days are harder than others. On those tough days, think back to why you started. What you're doing today matters, even when you can't see the results yet. Ideas are great, but it's what you do with them that counts. Find everything we talked about today at parlezvousceo.com. See you next week, and you've got this.